Our beloved National Health Service continues to be a historical monument for the United Kingdom. It has been the backbone on which this country has stood. The high quality healthcare service, free at the point of use, can sometimes be overlooked and thus undervalued. But in today's video, we'll explore the history of the much loved NHS and how it continues to operate as one of the largest public services in the world. The National Health Service, commonly known as the NHS, was established on the 5th of July in 1948 by the then incumbent Labour government. Its creation is often credited to Aneurin Bevan, who was the Minister of Health between 1945 to 1951, who sought to revise and administer the 1946 National Health Service Act. But before this, let's take a detailed look at the years prior to its creation. Healthcare was, of course, not free. Patients were generally expected to pay for their treatments. Healthcare systems and organizations were, in most cases, run by local authorities for local ratepayers. Amid the end of the Second World War, there were many critics of the current state of the healthcare system. Dr. A.J. Cronin, who was a Scottish novelist and physician, published a 446-page novel outlining the conscientious theme of medical ethics and also exposing the shortcomings of social and public services in England. His novel has been widely regarded as a noteworthy inspiration for the establishment of the National Health Service. A few years later, in November 1942, William Beveridge, a social economist who described himself as a liberal, published what was known as the Beveridge Report. In this, he outlined viable reforms to the system of social welfare. Some of his recommendations included cooperations being made between the state and the individual through policies of social security, the advocacy of social insurance, and his disagreement with benefits being means tested. His report was highly commended by all parties in the House of Commons and has been regarded as the blueprint for social policy for post-war Britain. In 1944, the then Minister for Health, Henry Walnick, put forward what was known as the White Paper, which set out a few guidelines for a completely new national health service. He argued that the NHS should be funded by general taxation and not by national insurance. It should be free to the point of use, two tropes carried by Bevan, although with its differences. Fast forward 7 years, the NHS experiences its first barrier. Due to international affairs, a falling public health spending as a proportion of GDP, which was minus 0.3 percentage points, the NHS backs away partially from one of its fundamental promises, free at the point of use. Hugh Gaitskell enters office as Labour's new Chancellor of the Exchequer and proposes a 1 shilling charge for both prescription and dental treatment. As a result, this saw Aneurin Bevan resign as Minister for Health in protest to an increase in defence spending at the expense of public health. This sparked an internal party division between those on the Bevanite left versus those on the Gaitskellite right, a division that we in current times are much familiar with. Since then, however, the NHS has seen massive growths in its infrastructure, in addition to more funding. In 1989, the NHS experienced its first considerable reform introduced by Ken Clarke. He introduced the concept of an internalised market within the healthcare system, in aims, as he claims, to drive and promote efficiency and competition. Some have questioned the long-term impacts of Clarke's reforms, and many have attributed them in part to the NHS's current challenges, such as increased waiting lists and the lack of spare capacity within hospitals. However, the NHS remains and continues to grow upon its principles. Since its establishment in 1948, it's been under the umbrella of 9 different political governments, and it has since reached major milestones within the field of medicine. Here are just some of the notable achievements and statistics. People now live on average at least 10 years longer than they did in 1948. There were 16,864 GPs in 1948 and 37,424 in 2022. In 1948, women spent on average 14 days in hospital after giving birth, significantly lower than today's average, which is around 1.6 days. There were 5,000 NHS consultants in 1948, and today there are 51 NHS consultants. In 1978, the world's first test tube baby was born. More than 1 million children have now been conceived in this way. In 1988, a comprehensive breast and cervical screening program was introduced for women. Since then, 100,000 breast cancers and 400,000 cervical abnormalities have been detected, and because of this, 6,000 lives are saved every single year. Millions of people, both young and old, have benefited from the NHS. Questions on reform or privatisation cannot negate the fact and belief that our national health system has been a flourishing part of our British society. The NHS may have its flaws, just like every public service, but its sheer reliability for a quarter of a century is commendable and indeed pinnacle to British society and tradition. If you enjoyed this video and want to see more, please be sure to subscribe and hit the bell notification. Our next video will explore the discussions about NHS privatisation and whether there's a feasible argument for it.